The COVID-19 coronavirus pandemic has been like a roller coaster, affecting many different people in many different ways with a variety of highs and lows. It's also impacted the amount of cases, deaths, and hospitalizations that were at one point going up like a roller coaster and are now going down like a roller coaster midway through 2020. The pandemic has also changed our daily routines at home, at work, and even at the hospital. The amount of cases, deaths, and hospitalizations from COVID-19 are trending in a positive direction right now, but the pandemic is far from over.
It's a roller coaster, and fortunately we're seeing finally the slope has decreased and become more flattened out. By no means is COVID over.
As cases were going up at the beginning of the pandemic, so did the need for beds and PPE gear. Dr. Ken Sable, the regional president for Hackensack Meridian Health Southern Market, explains that they've been constantly trying to secure as much PPE as possible then and now.
We continue to secure more and more. We've done a very good job leveraging our ability as a network to, secure adequate PPE and protective equipment for our team members and our patients.
Still, these were tough waters for any healthcare network or provider to handle and avoid any scenario that leaves them without enough PPE gear.
I can assure you and everybody listening or watching that at no time did any of our team members have to wear garbage bags or any of the things that you've seen in some of the New York hospitals when they were getting really, tight with PPE.
Throughout the pandemic, Dr. Sable says they've learned new information every day about the virus and how it spreads.
Initially, we were thinking it's all respiratory transmitted. Then we learned it was droplet transmitted. We still had questions whether the virus can live on surfaces. So we were being extra careful with that.
Dr. Sable said they're optimistic about some of the treatments so far for coronavirus, whether it's remdesivir or convalescent plasma.
We've had a good success with people who have recovered from the disease and have donated their plasma, hoping that the antibodies in their plasma could help patients who are infected recover faster by boosting their immune system to fight off the virus as well.
Even with the treatments available, a cure will be needed in the long run.
At the end of the day, we either need a vaccine or we need herd immunity, which is, a certain percentage, usually 60-70% or so of the population to have been infected and recovered in order to truly stop the spread of this virus.
One of the questions being floated around for people who have recovered from the coronavirus is, are they immune to getting it again?
If you are exposed to the virus, your body will develop antibodies to it, either IgM and then hopefully subsequently IgG, which tend to last a period of time. We don't yet know what titer level, how much antibody is required to give you that immunity, and we also don't know how long that immunity would last.
Thorough and constant cleaning as well as temperature checks for everyone entering a hospital have been major keys in helping to try and prevent the spread of coronavirus to date, and that's something continuing now and for a time to come.
We test all of our team members for antibodies and for the virus. Some of it is voluntary, some of it's mandatory. So in areas such as the operating room, the procedural areas where there's a high touch area with patients, we have mandated viral testing. We've tested all of our team members for the virus and for antibodies. We're checking temperatures for every patient that comes into the building and all team members. We are sanitizing all of our healthcare areas with UV ultraviolet technology. We are also using mist and other decontamination techniques. We are actively testing every patient that comes into the hospital who needs to be admitted. And based on that result, we're putting them on either a COVID floor or a non-COVID floor. So there is an enormous amount of activity throughout all of our hospitals, throughout all of our healthcare facilities in Hackensack Meridian Health to ensure that it is safe for both our team members and for the public to return.
Some of the ways we greet each other with a kiss, a hug, a high five, or a handshake are things of the past right now, and Dr. Sable doesn't recommend doing any of those things until a vaccine is found or we reach herd immunity, and even then, we may never go back to the handshake. At Jersey Shore University Medical Center in Neptune City, Vin Ebenau, Town Square Media News.